And in this segment, I will address some of your questions. And if y'all don't mind, I'm going to sit down because once I stand up over 2 hours, I know about it. So I'm going to sit, if you don't mind, and I can answer some of your questions.
Have a floating mic. Now let's make a few rules here on these questions though. So first of all, we do have a few people here that have already written questions, all right? Now, two things here. Ask one question at a time, all right? Because I'm sure there are many other people who will want to ask a question. Also, don't ask a question, how should I put this? For example, if a husband and a wife is here, you want your husband or your wife to behave a certain way. Don't ask a question relating to that so that you can kind of say, I told you so. We're not here for that. Or another church member. Like, ask a personal question that relates to you or a situation that you're dealing with. You catch what I'm saying? So, and also, like we said, don't take 2 minutes to give us a testimony. We don't need a testimony. Just ask the question to the point so we can keep rolling. Okay? So, do we have another mic that we can pass around as well?
Looking for it.
So we're going to sift through this. We start with 1 or 2 questions, and then we're going to take these because these were first, okay? So, health-related questions, yeah. Yeah. Go ahead, brother. There's another runner. Can we have another runner for this mic? Can we have one booth? So somebody can stay on this side, somebody can run the mic. Thank you, brother.
We just want to know about some remedies for distress, to release the stress or...
Okay, you want to know about stress, how to relieve stress. First thing, anytime I deal with stress-related problems, I would say you really need to seek some counseling from the pastor and the pastor's wife. And because it's depending on the nature of the stress. I think if you can't get stress, if you can't get any counseling from the pastor or his wife, you may want to have counseling from an aged man and his wife in the church. I would say that. Now, and that's just some counseling on how to deal with the stress. Now, the physical way of dealing with stress is, and I don't know the nature of it, I'm talking in general stress. There is a vitamin called L-tryptophan. L-tryptophan. And I would say you need to take 500 milligrams of L-tryptophan twice a day. L-tryptophan. I also would say that you need to take some B vitamins. Get a B vitamin complex. Take 100 milligrams of vitamin B complex a day. I will reduce my sugar intake because sugar definitely destroy of your nerve vitamins. Basically, I would change my diet, try to eat healthy, and I would get involved in spiritual activity, church-related activities. The best way to deal with stress is to find someone worse off than your stress-related condition. Help them, and you lose sight of your personal stress-related conditions.
Okay. My question is, you were talking about putting the honey and lemon in the eyes. Does it work for people who've had cataract surgeries? Because I have lenses in. Is that going to affect it?
Well, let me ask you this here. Are you taking an eye drop?
The eye drops, yes.
You do, you're taking eye drops, right? You use eye drops.
Use eye drops for the dryness of the eye.
For the dryness, right.
Mm-hmm.
Well, the lemon drops and the honey would do the same thing. The reason why you need eye drops is in the corner of your eyes, you have a optical duct that release fluid and moisture your eyes. If a person have high cholesterol, those ducts can become blocked, like hardening of the arteries. And so when they need to release the fluid to keep their eyes moist, it won't happen. And that could damage the optic nerve, that could produce cataracts, that could cause detached retina, a lot of problems. So to answer your question, is that the lemon juice and honey, all it's going to do is to clean out that duct. It will not restore your vision. God has put in the fluid and your optical fluid in your eye, He has put special enzymes in there to repair your damaged eyes. All the honey and lemon juice does, clean out the arteries. Even though you had even it would still do it. Now, I want to give you an idea. You've seen these pictures called OxyClean. They have a platter, a greasy platter, and they stick it down in some soap and water, and when they pick it up, it's clean. The way that works is they use citric acids. Citric acids made from lemons and grapefruit and oranges emulsifies the fat. It brings about a chemical reaction that take the fat globules and reduce them to real small so they will not cling to the platter. And it instantly clean it. Well, the lemon juice that you put in your eye is high in citric acids. It will take the fat deposits in your arteries and dissolve the fat deposits so that the fluid can be set free. And so I would use it if I was you.
I have something here in Spanish, so I'm going to let you know. Remedy for lung cancer and what to do with metastasis of colorectal cancer.
Okay, with lung cancer, and once again, I don't know the degree of it. I'm just speaking in general. If they're not on oxygen, if they're on oxygen, I don't know. I don't know what their oxygen saturation is. If their oxygen saturation is not too bad, they still have a pretty good chance. I don't know if they're on a breathing machine. So I'm letting you know a lot of things I don't know. This is where personal assessment would work. I would advise a person with serious problems like that is to email me and tell me as much about their problem as possible. Let me put together a complete treatment protocol for them. That would be the best. Now, I'm going to tell you some things to do, but I'm saying you really need I really need a complete assessment so I can put together a complete protocol. Let me tell you some things to do for lung problem. You need to get you a product called menthol crystals. Menthol crystals. Menthol crystals is not peppermint. It is 10 to 20 times stronger than peppermint. Take 1 tablespoon of menthol crystals, put it in a pot of boiling water or in a vaporizer. You can take a pot of boiling water and set it in your bedroom. It do not have to be on the heat, but it should be boiling when you set it there. Put 1 tablespoon of menthol crystals in it and let it set there. It will vaporize the room. Even if you on a breathing machine, you will not need it. This will help you respirate, and it's unreal how well it works in respirating your lungs. So that's the number one thing I would do. So you wouldn't have this shortness of breath. You'll breathe easy with that. If you have asthma, bronchitis, it's fantastic. Also, I would make a cough syrup, a respiratory syrup, similar to the one we made here. But I would use horseradish root with the garlic, with the onion, with the lemon juice, with the honey, with the cayenne pepper. I would make that and I would take that. I would also take the herbal chemo, but I would customize the herbal chemo with really good herbs like pleurisy root, mullein, herbs that really attacks the lungs. I would customize it and I would give them that to drink. I would give them steam baths, fever baths, I will apply hot poultice to the chest. And if they have emphysema with a lot of pinholes in the lungs, where they cannot hold oxygen in the lungs, then I would get fructose and anise oil, and I would mix that in the fructose, and I let a person eat anise oil. I would let them eat a teaspoon to a tablespoon of that twice a day, and that will help seal up those pinholes. I would also take a paper bag. I would take activated charcoal and put it in the paper bag. I would shake it up and have a person to breathe the dust from the charcoal. They found that men that work in coal mines, they suffer from black lungs, but they never have emphysema because the charcoal particles plug up the little pinholes, and it makes them be able to retain oxygen in their lungs. So I would do that. Those are the things I would do in a general program. Say, write me and let me put up a more designed program for you.
Okay, hi, thank you. When you have a person that is 2 or 3 days, they've been told that they might die within that period, and they have metastasis to the brain all over the body and a lot of pain and semi-unconscious, what type of treatment do you recommend?
Well, now,
Especially for the pain,
okay, if a person is unconscious,
semi-unconscious.
okay, are you semi-unconscious? Then that tells me they probably over-medicated. If they're over-medicated to deal with the too much oxycodone, too much codeine, too much morphine, they're going to sleep to help them deal with the pain. Then codeine, that morphine is shutting down their liver and their kidneys. And I know they do this because that's the typical protocol, and it makes them sleep till they sleep away from here. Their kidneys shut down, and when the kidneys shut down, it's finished. So what I would do, I would try to get them off of the oxycodone, codeine, and morphine as soon as possible. I would put them on an herb called Jamaican dogwood. I would get me some kava kava, valerian, and Jamaican dogwood. I would take 2 pots Jamaican dogwood, 1 pot kava kava, 1 pot valerian, and I would mix it together, make a strong tea, and I would let a person drink that. That's the strongest pain medicine we have in the herbal kingdom. It's equivalent to morphine, and I would give them that. It would be less toxic for their liver and kidney than codeine and morphine. I would sponge them down with olive oil, and I would sponge them down with DMSO, and I would put them under these infrared lights to try to reduce the pain. I would try to keep fluid in their body to keep their kidneys from shutting down. I make sure their bowels are moving. If I had to, I would feed them through their rectum, and I would just pray for some time. If there's pressure on the brain because of brain cancer, I would take a block of tofu. I would crumble it up. I would take 3 ounces of garlic, 3 ounces of ginger. I would take 3 ounces of bread flour, and I would mix that all like I'm making biscuits. I would mix it all up together, and I put that in the freezer, and I get it really cold. I wouldn't freeze it where it's hot, but real cold. I would take it out, lay it on the table, put a piece of white cotton cloth under the bottom and on the top of it. I'll take rolling pins and roll it flat like I'm going to make biscuits. I would lift it up and lay it on that person's head. Well, hold up a minute. Before I roll it on their head, I would cut their hair down close as I can. I would take some olive oil and I would rub their head with olive oil. I would take DMSO and I would pat that all over their head. I would lift up the tofu poultice, mold that on their head, wrap it real good, put plastic over it, secure it. That will reduce the pressure which is going to kill them the fastest way. When that pressure, that brain increases, they're going to go in, their eyes are crossed, they go into convulsions, it's going to kill them. This would bring the pressure down faster than anything. I would also put their feet in some hot water to channel the blood from their upper extremities down to their lower extremities. And I would just pray that God would give them a little extra time.
Does the marijuana might help?
Ma'am?
Marijuana? The marijuana that you
Yes,
would that also help?
Now, I would try to get them, yes, and put it on their tongue, but they need to be somewhat conscious when you do that. Put it under their tongue, in their tongue if they're semi-conscious. I would do that, yes. Not the marijuana now. Please don't say this brother up here teaching marijuana. but the CBD, the cannabidiol, okay? Well, if this get out that I'm up teaching marijuana, I'm going to be in a lot of trouble. Okay.
Two questions, Brother Wilson. It deals with the thyroid gland. First one is about herbal remedies and treatment for enlarged thyroid gland. The other one is about, she said, hello and thank you for this class. I was diagnosed 17 years ago with Graves' disease and treated with 2 radiation, maybe I-131 treatments. Now I have hypothyroid. I truly believe that it is the root of multiple symptoms I feel almost every day. 2 years ago, I became a vegetarian. My symptoms have improved a lot, but not completely gone away. What would be your recommendation? Thank you. This is from a Rosa Luna.
Well, and it's fitting, my wife would walk in here because she had Graves' disease. She had hypothyroid. And she had it in the worst way. They had to do resuscitation on her several times. She was gone. She had the lung of an 80-year-old woman. Her body was swollen up with fluids. And they told her that she was in no physical condition to have a baby. And she was pregnant. And my wife, they wanted to abort my child. She said, no, I'd go before I'd take him out. She settled down and got into a serious program to deal with hypothyroid or Graves' disease. What we had to do, and this is one where I would definitely have to do a private assessment with, one you'd have to design a program, because Graves' disease can make you develop a thyroid storm. Now, I don't know if you're not medical minded, you may not know what a thyroid storm is, but a thyroid storm is where your body uptake all that iodine and can't metabolize it to thyroxine, and it becomes toxic to the thyroid and it can kill you. It can make you have a major heart attack. So I do need a private consultation with that person. That person needs to contact me, and we'll put them on the same program we did my wife. But for the sake of the class here, they need an herb called bugleweed. Bugleweed. Bugleweed is especially for Graves' disease and hypothyroid. They're going to need iodine. They're going to need iodine, but the iodine must be able to be uptaked or converted to thyroxine. So when they take the iodine, they're going to have to take thyroxine. They're going to have to take tyrosine. You can buy tyrosine at the health food store. You take 500 milligrams of tyrosine 2 to 3 times a day with liquid Norwegian kelp, which is high in iodine. The thyroxine will the tyrosine will convert the thyroxine. The tyrosine will convert the iodine to thyroxine, which will prevent it from producing a thyroid storm. I would probably put you on a lot of vegetables, because vegetables high in glutathione suppress and slow down the thyroid function. If you have hypothyroid, you need a lot of vegetables like cabbage and broccoli and cabbage and cauliflower. It has glutathione in it. The glutathione enzyme slow down the thyroid function. If you hypothyroid, that's slow thyroid, don't eat very small amounts of broccoli, cabbage, and cauliflower, because it slow down your thyroid function. If you're already hypo, like most women are, you don't want to slow your thyroid down. That's going to make you pick up more weight. That's going to make you have more problems. So you really need to know, is it hypo or hyper?
Thank you for that question, answer. Here's another one. She's asking about edema of the legs. Edema, what can be done about it?
Yeah, edema is where the fluid is trapped because of a malfunction of the lymphatic system. The lymph glands are to channel that fluid away. Edema can come from kidney problems, cardiovascular problems, problem with your veins and arteries. Consuming too much salt is another thing can do that. Eating too much protein can do that. Chilling your lower extremities can cause that. Wearing tight banding around your lower extremities, socks or tight shoes can do that. Varicose veins, phlebitis. There's a number of things can cause that. Elephantitis can come from an infection that can cause you to develop really huge edema. So, and I'm speaking in general, once again, because I don't know a lot about the circumstance, typically what you want to do is to keep the leg elevated. And you want to make a cayenne salve, and you want to rub the lower extremities with a good cayenne salve and do some pressure bandages with the leg elevated to channel the fluid away from the lower extremities. And you want to give some real strong diuretics to flush the fluid out once you channel it from the lower extremities. Contact me and I'll be more than happy to put together your more detailed program on that.
If I understand you correctly, you're saying that malignant cells thrive in area where there's no oxygen. So my question to you is, what is your take on ozone therapy?
I like the hyperbaric chambers. I like ozone therapy. I like hydrogen peroxide therapy. I like vitamin C. I like antioxidant therapy. All of those are designed to regulate the utilization of oxygen. I think it's fantastic. Now, cancer cells must have oxygen in order to grow. But though that oxygen helps feed the abnormal cells and blood vessels, but it converts that into lactic acids, which is not healthy. So it do need oxygen. Don't need as much as healthy cells, but it do need it. So the hyperbaric chambers, the oxygen tent, hydrogen peroxide therapy gives those cancer cells more oxygen than what it needs. And so, yes, it will be quite effective in reducing cancer metastasis.
Any questions on this side?
Can papaya seeds be used for medicinal purposes?
Yes, they can. Papaya seeds are really good for parasites, and also it's good for your platelets. If your platelets count is low, you can grind up the papaya seeds, make a tea out of it, or you can make a tea out of the leaves and drink that, and that will bring up your platelet count. You need your platelet count at a certain level, or else you could bleed to death. So those are some really important things that papaya leaves and seeds can be quite useful with.
Okay, here's a question about fibromyalgia and chronic allergies and asthma.
Well, that's a lot going on there. So I'm just going to deal with
Fibromyalgia.
well, the fibromyalgia is related to a rheumatoid or related condition, and a painful condition. Once again, with that, I would use the DMSO and olive oil treatment with the heat lamps. And that would get him a lot of relief from the fibromyalgia. I would definitely detox the body, try to clean it out to reduce the toxicity in the body. And, you know, and I think that would help them a lot with that.
Yes, I want to know about kidney failure. it goes through 5 stages of development. So what procedure do you have to stop that development? Let's say someone in stage 1, or I mean stage 2. We don't want him to go to stage 3, or we want him to even go back to stage 1. What procedure do you have to help in this regard?
Kidney failure is one of the most difficult cases to work with. It's one that I've had a lot of experience working with, though. Now, it is one of the most complicated cases because a lot of things can cause a kidney to malfunction. One, poor assimilation of potassium, which is the toughest one because your potassium is in most of your healthy foods. And if the kidney cannot break down and utilize potassium, it will store the potassium, and potassium can kill the kidneys. So we have to reduce the potassium. And the only way you can reduce that potassium and still eat semi-decent, you must cook all your vegetables to reduce the potassium. Now, so I've said, first of all, try to eliminate or reduce a lot of your high potassium food, if it's potassium. If it's sodium, reduce your sodium. If it's protein, reduce the protein. If it's phosphorus, reduce the phosphorus. So that's the diet. Now for treating it, you want to get some nettle seeds, not the nettle leaves, the nettle seeds. I have had 90% success rate with kidney failure, 3rd stage kidney failure, with what I'm going to tell you now. It is fantastic. Take the nettle seeds, they're little tiny seeds. You only need 1/3 of a teaspoon of nettle seeds. Grind them up to a powder, make a tea out of it. Let a person drink that twice a day. Take 1/3 of a teaspoon of baking soda, aluminum-free baking soda. Mix that in 4 ounces of water, let them drink that twice a day. Regulate their fluid intake. Regulate their fluid intake. Don't overload the kidney until we get them back working. And then continue to regulate that diet. I would get them some steam baths so I could take some of the stress off the kidneys. And in a large sense, I'd probably get them some cranberry juice. And in a large sense, I can pretty much get those kidneys back working if they're at least working 15 to 20%. If the kidney is not working, is working less than 15%, I don't know if we can get them back. If they can't urinate, it's going to be difficult. If they be on dialysis a year, 2, 3 years, the kidneys is already pretty much dead. It may be hard to get them back. And the only way you will know is you go to get your dialysis, and they see that sometimes your kidneys are functioning better. You ask the person, well, how's my kidney doing now? And they say, well, your kidneys is functioning a little better this time. Keep doing what you're doing. Monitor that. Monitor your kidney functions. If your kidneys are fluctuating from doing good sometime to bad sometime, that may be a key that your kidneys are trying to work. If you take the stress off the kidneys, now one I failed to mention, improper blood flow to the kidneys is one of the major causes of kidney failure. If they don't get enough blood to the kidneys will die. So you've got to get better blood flow to the kidneys to be able to restore them back. Well, aluminum-free baking soda, you just take the 1/3 of a teaspoon, you mix it in water, and you drink it twice a day. You do that to change the pH. You want to change the pH of your body. You want to get it at least up to 7.5 to close to 8 to change that pH. And that takes the stress off the kidneys.
Okay, what's your recommendation for the treatment of osteoporosis?
Well, osteoporosis is bone weakness. A lot of women, when they get into perimenopause and the ovaries begin to shut down, they don't produce enough estrogen. And when they don't produce enough estrogen, their bones become brittle. So What you need to do is to increase your estrogenic foods, estrogenic herbs like red clover, soy. You also need to take supplementations of calcium, magnesium. You need liquid calcium and magnesium. You need vitamin D, which is vital. You must have the vitamin D, liquid calcium, and liquid magnesium to be able to have a good chance to get those bones back strong. You need to get on a nice monitor exercise program. If your bone structure is too brittle for you to walk, come up with some way to exercise, because exercising will increase the strength of those bones. Reduce the amount of phosphorus. Don't overload yourself with a lot of dried beans. Phosphorus, too much phosphorus can interfere with calcium assimilation. You do need beans, you need protein, but you don't want too much of it, because too much phosphorus will throw off the balance of calcium, and that would interfere with your body uptaking the calcium. So don't eat beans no more than twice a week.
What can be done for loss of hearing and salty bumps?
Now, what was that?
What can be done for loss of hearing and salty nips? What are bumps? Or?
Well, a loss of hearing, once again, that can be from too much wax in the ear. Okay, well, I'm just saying, I'm giving you different things. It can be from a damaged middle eardrum. So it can be from an infection in the middle eardrum. It can be from too much candida yeast in the ear. Now, if you're picking up a fungus in the ear, then it may be associated with candida. I don't know what that is.
Question.
Mm-hmm. Well, I guess probably no one will know what it is, but is it bothering you? Is it growing? Well, I'm just going to tell you like this. If it's not bothering you and it's not growing, I'll leave it alone. But now, if you just want to take it out, you go on the internet and look up a product called black salve. Black salve. And since it's a little bump, use about as much as the tip of a match head. A very little drop, about the size of a match head. Stick it on that bump and put a bandage on it. It's going to burn a hole in the skin and go down and pull that little bump out. I wouldn't mess with it unless it was causing me problems.
What is your thought on nightshades?
Well, I'm not an advocate of this anti-nightshade concept, because a lot of nightshades are very healthy vegetable products. And so I've never advocated that. Jeffro Klaus never did it. And Dr. Christopher, they the old masters, herbalists, they never spoke out against that. It's these modern herbalists that speaks out against that. I'm from the old school, and I don't believe that. I believe you can eat nightshades and it will not cause any inflammation in the body. I just think everything needs to be balanced when you eat.
I would like to make a Spanish question, please. Nos mostró fotos de casos muy dramáticos.
Of very dramatic cases.
¿Tiene fotos de la recuperación de los pacientes?
Do you have pictures, photos of the recovery of those patients?
I do.
do you? Dice que sí.
Yes, I do.
Okay.
I didn't go through everything because of time, but this man that had the big tumor on his face, I have him all the way. I follow my people I work with from the beginning to the end, and I have it on that same PowerPoint. If you get the PowerPoints, you'll see it. You've seen it when the tumor was coming out, when it was swollen. That's when it was all swollen up. When it healed, all it left was just a little spot on his cheek. That lady that you saw with that big tumor in her mouth, you'll see when those tumors all came out and her face looked perfectly normal, except for a little spot on the side of her cheek.
Okay.
There's a question here. I'm going to try to read it. It's, for sure it's a lady with a stage 4-5 ovarian cancer. She says she was told 6 months to live. And first chemo, she felt like blowout. So she's having kidney problems and want to know what to do.
Okay, now what I'm hearing is she got ovarian cancer.
Stage 4-5.
And she has kidney failure.
Yeah, it's beginning with.
Beginning of kidney problem. Now, I don't know if the ovarian has metastasized to the kidneys. I don't know that. I'm just, the ovarian cancer is one that's probably associated with too much estrogen. There's a product called Easter lily. They make it from the Easter lily flower. And it'll be coming up soon, near Easter, where you go out and you buy these big, beautiful Easter lilies, plants. You make a water extract out of those. And there's 70% success rate in dealing with ovarian cancer. Now, you can buy the water extract off the internet. Look up Easter lily extract. Buy you several bottles. Start taking that. Reduce the amount of estrogen in your diet. And give it time. And this is one where I would recommend that you contact us and let us help you in putting together a program.
Preventive loss of knee cartilage.
Now, anytime you have a condition in your knees and it's so painful you can't walk, and if you're not a diabetic, I'm going to tell you a very successful treatment. If you're a diabetic, you cannot do this treatment. If you're a diabetic, you cannot do this treatment. If you're diabetic, please don't do this treatment, okay? I had to repeat it because I only care how many times I tell this, somebody get it wrong and apply this treatment on a diabetic, and boy, it's a big problem. Take 1 bulb of garlic, chop it up, garlic. Chop it up, put it in a blender, add just enough water to make a paste out of it, a thick paste. Spread it out on a piece of cloth. Lay the garlic poultice on the top of the kneecap, like you see right here, on this part right here. Please don't put it on the side. Don't put it in the back. Put it on the top of the kneecap. Are you following me? Wrap it, secure it real well. That garlic is going to burn you like a 3rd-degree burn. It's going to put big blisters, sometimes as big as a chicken egg, going to come up. It's going to be very painful. If you can stand that for 6 hours, your knee problem will be over with. Take a sterilized needle and prick those blisters. And all that fluid is going to run out. It's going to draw all the inflammation out of that knee. All of it. When you finish, those blisters are going to swell up like this. They're going to swell up like that. If you rub it because it's pain, oh, that hurt, you're going to offset that tissue. And when them blisters, when that scab set down, it won't line up. Your body going to shed that skin and going to leave that kneecap raw till it grow back the membrane again. So please do not touch it. Once it's swelled, let it come up. Then prick it drain all the fluid off, it'll set right back up and line right back up, and it will not leave a scar on your leg at all. Won't even leave a scar, nothing, if you don't rub it. Most people, they go to hurting, they go to rubbing, and that's where the problem is. Once it's set back down, take some aloe vera, and he had the aloe vera plant right here. Apply an aloe vera poultice over it. I'll put sugar on it. Honey. Put honey or aloe vera on it until it heals up. And you'll be able to walk the same day that you applied that treatment. It is very painful. Please, if you're diabetic, don't use this treatment because you cannot blister a diabetic. 1 bulb of garlic with a little water just to make a paste.
Pain or for the rejuvenating of the...
Yeah, this is just to move the inflammation.
Oh, okay.
That's all it's going to do. Now, you have ward off the cartilage because it was bone against bone. You got to keep that inflammation away in order for it can grow the cartilage again. It won't do it as long as the inflammation is there.
Okay, let me translate this for you. What can you say about mud, clay?
Clay.
Clay to relieve swelling. And what can you say about activated charcoal and a poultice for cleaning wounds?
Well, charcoal and clay have what we call a carbon action. It's pure carbon. And so that means it has the ability to absorb, it's many times its own strength. A charcoal is a carbon. Under the microscope, it's got little cradles, in it. You can see little round holes in the charcoal under the microscope. When the charcoal is activated, the little holes are really large. When they're not activated, they're small. The larger the little holes under the microscope, the greater it would absorb its own strength. So when you apply charcoal, activated charcoal of inflammation, it would absorb the inflammation into the molecules of the charcoal. Clay would do the same thing. So it would actually pull the inflammation out and trap it in the charcoal out of clay. So these are wonderful treatments. We give whole body mud baths where we cover a person's whole body up with mud and pull out inflammation and toxin out of their body.
Here's an interesting question. I think I have a problem with absorption. Many times I've seen the food I've eaten, sometimes not even 12 hours before, show up in the toilet almost unchanged. It does not feel like diarrhea and is usually formed, but too many times it's just, excuse the imagery, like applesauce. Beyond that, it does not matter how much I eat. I am constantly hungry. I do not acquire a feeling of satisfaction at being filled, but only in my stomach. But I do not feel nourished inside and the rest of my body, and within 3 or 4 hours, I am close to fainting. I am not very physically active, and my weight does not change.
Okay, I pretty much know what it is. Malabsorption, and and probably have a irritable bowel related condition where it's moving, the transit time is moving through the system too fast, and they're not extracting enough of the nutrients from the food. So that could either come from a thyroid problem, or that could come from an irritable bowel related condition, or it could be from a gluten intolerance related problem, celiac problem. But either way, it's a digestion and assimilation problem. The reason they're feeling tired is because they're malnourished. They need to slow down the bowels enough so that the bowel salts and the minerals can be extracted from it. They need a bowel cleanser that will add more bulk and roughness and fiber to the diet so that the stew won't come out loose. And so I would take the psyllium, and I would take some bran fiber and add to it, and I would let them take a tablespoon of that at least twice a day. And I would investigate to see, is it possible they're having some gluten intolerance, or they having some celiac problem or irritable bowel condition. And I'm not sure which one those might be.
Let's have an announcement from our sponsor.
Well, we know some folks might be leaving, but here's the thing. These are the 3 books that are from the Wilson's ministry, Centurion ministry. Right now, Sister Wilson is in the back of the church there. If you guys need them, please get them. It's a package of 3 books. I suggest you buy all 3 of them together, right? It's just $75. It's not a lot. It's not even $100, guys. This is a worthy investment. I think every single home should have one, right? We had these months ago. You should have one. So one is dealing exactly with cancer. You find the cancer in here, it gives you the prescription, as it were, to kind of work with that, okay? The other one is what this seminar has been called, Back to Adam, right? You have causes and treatments here, natural remedies for different conditions and whatnot. And I think, Brother Wilson, this one we use at the school, right?
All the remedies that I'm talking about is in this book.
Bam.
This book has hundreds of remedies. The reason I know all these remedies is I put them in this book. Everything I've talked about can possibly be found in this book on the quick remedies.
So again, it's only $75. They are back there. If you know someone, if you have the funds, that is, that you can buy a gift as a gift for someone, I recommend. I know there are a few people even in our midst that you may be aware of, and they really don't have money. So if you have the means and you're able to maybe buy an extra copy. I know, well, there's one person here right now I know can really benefit from having an extra copy, but I know they don't have the funds. So if you are able to buy an extra copy for someone, I would ask that you consider doing that. Okay? God bless. So back there, you can come back in, but before the night is over, make sure you get a copy of the books. God bless.
Yeah. Mouth blisters, cure, remedy for mouth blisters.
Okay, now, mouth blisters. I'm just not sure what you mean by mouth blisters.
Like you get little ampollas. I know you don't know. Yeah, that.
Canker sores.
Yeah.
Yeah. It possibly could be, immune system, a viral component that's causing that. Now, what I like to do is to go get some dolomite calcium, grind it up to a powder, put it in water and make a paste out of it and smear it over the top. That usually take them out in about 24 hours. So you know what dolomite? No. Dolomite is, you can get that from the drugstore. It's a calcium supplement. And you grind it up, they come in tablets, crush it up to a powder, put a little water and make a paste and smear that over the top. And that usually will heal up those canker sores in about 24 hours. You might want to work on your immune system because they will come up, they call fever blisters, canker sores, especially when your immune system get down. I would work on that.
Yes, I was going to ask you a question on the apple cider for the arthritis with feet. Does it also help for people that have diabetes, that have pain in their feet? Does that help to use that?
Neuropathy, the diabetic pain, it is really tough. It's a nerve pain that diabetics get. The most effective remedy that I know to deal with neuropathy pain is rub your area with olive oil, make a cayenne salve, take 6 teaspoons of cayenne pepper, 8 ounces of this vegetable shortening. This one right here is good. and put about a tablespoonful of peppermint extract, or peppermint oil in it. Mix that up real good. And rub that over the neuropathy pain. About 8 ounces of the olive oil, 6 or 7 tablespoons of cayenne pepper, and rub that over the neuropathy pain. Now, if that don't stop it, this will. Rub your leg, wherever the neuropathy pain is, with olive oil, and rub DMSO over the top of it, and use that heat lamp. That you'll knock it out within minutes. That was a nerve pain, neuropathy. Too much sugar in the blood would do that. If your sugar level is too high, it's going to irritate the nerves and give you neuropathy pain.
I want to put on some muscles, right? And like a weight builder. I just want to look real puff. Do you have anything natural anabolic steroids that you can prescribe?
Yeah. First of all, are you exercising?
I just walk, but I could do more.
Yeah. Now, you got to do more than that. You're going to have to really tone those muscles. You got to burn those calories in those muscles. And so, otherwise, you won't do it. If you're just walking, you're going to lose weight. But you got to lift some weight. You got to do some setups. You got to do some pull-ups. You got to strain those muscles. Okay. Well, that's what it's going to take. And it's going to take a little extra protein, a vegetable-based protein, in the forms of beans, in the form of soy, and get plenty of exercise. And how many meals a day you eat? Now, you won't never build no muscle with 2 meals. You're going to have 3 meals a day.
Okay.
Now, you have a pretty good appetite?
Huh?
Do you have a pretty good appetite?
Do I have a good appetite?
Yeah.
Yeah, I got a good appetite.
Okay. Well, if you got a real good appetite, really good appetite, and you're not gaining weight, you might want to look at parasites.
Parasite?
Yes.
Okay.
Because the parasites may be eating more than you eat. So you might want to go on a parasite cleanse to clean out the parasites. You might want to get you some black walnut and some wormwood and ginger and take the parasite. In my book, there's a formula for parasites that will clean out the parasites. Most of the time when people need to gain weight, we put them on a parasite cleanse, get them 3 meals a day, and they start picking up weight. And if you want to build muscle mass, let's increase your exercise. Lifting and, all right.
What is your best suggestion for bone spurs in the neck and shoulder and arm?
Yeah, I've worked with this a lot too. The bone spurs in the shoulder, where people got bursitis, they can't lift their shoulders up, their neck popping. Once again, you're going to get tired of hearing this, but this is the one that worked. Take some olive oil, rub it over the area, rub DMSO on it. Keep doing it. Just keep on doing that. Thank you.
I ask you if far infrared sauna would help to do what you just said.
Well, it will, but the only thing, see, you got to dissolve those calcium spurs. Trust me, the olive oil and DMSO, if you got bursitis, you can't lift that shoulder, do that for about 2 weeks, you'll be able to lift it up. It's going to dissolve those calcium spurs. It will do it.
But should I go into the sauna or without the sauna?
Well, you can, but if you can't do sauna, just take a simple red light bulb like that.
I have the sauna.
Okay, we'll use the sauna. Now, you might want to do some castor oil packs to speed it up. Some warm castor oil packs over the area to help soften up the calcium deposits. Then use the DMSO and olive oil. I've had it in, people had it in the neck and shoulder. Been 3 weeks, it'll usually clear it up.
Is that the same for the bone spur in your foot?
It
The same
is
treatment?
very simple, but bone spurs in the foot can come from calcium deposits. That's where you want to use the apple cider vinegar to dissolve those. I would soak my foot in hot vinegar to try to dissolve those spurs.
Question. Arthritis in the shoulder.
The same as that bursitis.
That's
the same treatment as the bursitis.
And do you have something for athlete's foot?
I what?
Athlete's foot? The fungus?
Yeah. That vinegar and tea tree oil.
Vinegar?
Yes. Soak your feet in regular vinegar. Tea tree oil. Take the tea tree oil and rub that around your toenails. No, just take the tea tree oil and rub that around your toenails, because the fungus can get up under your toenails, and the vinegar can't get under there and get it. Rub the tea tree oil around your toenail and soak your feet in vinegar. And remember that it's a fungal infection, so that when you wash your cotton socks, you're not getting rid of the fungus. It's not going to kill it. So you can wash it, and you put it on, you're going to reinfect yourself. I tell women this that have vaginal infections from candida. They keep getting the vaginal infection. They take their undergarments, they wash it, they put them back on, they reinfect themselves. Because washing will not kill the candida bacteria. It won't do it. The only way you're going to kill it, you had to put your undergarments in the microwave. I'm sorry. It will kill them until you get over the yeast infection. Socks too. Yeah, the socks. Just wet your socks a little bit, put them in there, and let the microwave kill it. It will kill those yeast infections.
Tender. I have some questions here in Spanish. First, a remedy for ringing on the ears.
Well, a lot of times the ringing in the ear may be from some type of infection to the eardrum, or it could be some wax buildup in the eardrum. It could be a sinus drainage that is infecting the ear. So I would address all those areas. First thing I would do, I would clean out the wax. If there's any wax, I try to get your ears cleaned out. And just see would that solve your problem. If that don't solve your problem, then it's possible that you could have some type of yeast infection. That's where I would use the onion poultice with the garlic drops in the ear and apply the onion poultice to try to draw it out. Y'all won't have to buy my book because y'all done got it all from me here sitting here tonight. Okay. I do heat it up, yes. Yeah, put some garlic oil in your ear, about 2 or 3 drops in your ears.
Okay.
Well, you just take your garlic and you press it. Press it in olive oil. That makes your garlic oil. And then just take about 2 drops and drop that in your ear. And then take the warm onion poultice and apply it over your ear and wrap it. 3 to 5 hours.
Okay. There's a question here. The reason why the age spots in your hands appear with the age spots.
They call it age spots. They call it liver spots.
Something to do for, take it out.
Yeah, they call it age spots. Sometimes they call it liver spots. But really what it is a deficiency in vitamin C. And what you need to do is increase your vitamin C level. And that will clear it up in time. So, and go on a liver flush. Just go on a good liver flush and increase a little vitamin C. Now, what is a liver flush? You take the juice of 5 lemons and you mix that and 1 ounce of olive oil, and you drink that first thing in the morning on an empty stomach. You wait about 2 hours before you eat or drink anything. If you don't, you're going to throw up. Then the next day, you take the juice of 10 lemons and 1 ounce of olive oil. You drink that a couple of hours before you eat or drink anything. And then the third day, you take the juice of 15 lemons, 1 ounce of olive oil, and then wait a couple of hours before you eat. Same token, take a small coffee enema, about a 4 to 6 ounce coffee retention enema, to pull the bile out of the gallbladder duct. Do that each day for about 3 days, and that should get your liver back functioning properly.
Okay. And there's another, it's a 20-year-old boy, wants to know how to lose weight.
How to lose weight?
Yeah.
How to lose weight? Well, in losing weight, I mean, you know, you have to consider your calorie intake. If you're taking in more calories than you're burning, you're going to gain weight. So, in that case, I would definitely increase my walking. I would decrease my simple carbohydrates. I would eat more complex carbohydrates. And I'm talking about I eliminate a lot of the junk food, and I'll eat more of the complex carbohydrates and fruits and vegetables. And, you know, I would investigate. I probably will get a medical test done to check my thyroid to see if my thyroid is a little sluggish, because it could be slow, and that could be causing you to, you know, store calories. So those are probably things I would do to begin with. There's some wonderful herbs that can help your metabolism and make you burn weight, like bladderwrack, kelp. You know, those herbs can help you speed up your metabolism. Bladderwrack. That's a seaweed.
If a person has had pneumonia, how can they improve their lungs? Because they have a hard time still breathing, and they have a little bit of fluid in one of their lungs. How can they improve that?
This is where I would definitely get the menthol crystals. I would take 1 tablespoon of menthol crystals, and I put that in a pot of hot boiling water and set that next to the bed. Also, I would take 3 ounces of blended horseradish root, 3 ounces of blended garlic, 3 ounces of blended onion, and I would mix that in 8 to 10 ounces of honey, 4 ounces of lemon juice, and a little cayenne pepper. And I would give that person to take a teaspoon of that as often as they want. That would strengthen their lungs so they can respirate. That would help pull that fluid out and mucus out of the lung area. All of that is in my book also.
Nobody? I have a question. What's your opinion about using peroxide, 2 or 3 drops into your ear when you're starting with a common cold?
When you're starting with what?
Common cold.
Oh, common cold. You said that put the parasite.
2 or 3 drops of peroxide into your ears.
I've never done that. I've never done that. Now, so I'm not sure about that. I'm not saying it won't work. I've never done it. I know people have candida of the middle ear, a yeast infection of the middle ear, and I work with that, but I never work with trying to put a parasite tincture or whatever it is in the ear.
It doesn't irritate.
Okay.
Because I have used it to remove wax, earwax.
Yeah.
But there's I hear about it that to use 2 or 3 drops into your ears when you're starting with a cold.
Right. I'm not.
You're
I've
not
never
familiar
done
with that. All right.
Are you talking about hydrogen peroxide?
Yeah.
I'm familiar with hydrogen peroxide.
Oxygenated water.
Well, 3% or
3%.
6%. Yes, I mean, you can definitely put that in the ear to clean out the wax. And, you know, we do that all the time, so that's no problem with that. But I wasn't familiar with the parasite cleaning. Yeah, but the hydrogen peroxide is fine for that.
Okay.
How does this? I asked earlier about hearing loss. To put garlic, you know, squeeze the garlic so you get the garlic oil with olive oil and put a couple drops in your ear overnight.
Well, I mean, you know, the garlic in your ear will help with your hearing because you could have a middle ear infection. And it would help reduce that infection. Now, years ago when I was young, there's an old midwife trick they used to use on children that had hearing problems. And they would take the colostrum and put 3 drops of colostrum in the child's ear. And that, in some cases, would restore the hearing back. Now, you know what colostrum is. Yeah, and so that's what the old midwives trick of helping somebody that lost their hearing.
My question is just concerning, I guess, like the back. Are there any remedies or therapies for like leg pain? Maybe like say like the hips or the pelvis or even the parts of the spine and the vertebrae are twisted in a way that you get pain in other places?
Well, now, if you're talking about scoliosis, that's where the spine twists. Because I'm hearing 2 things. I hear something sound like scoliosis, and I also hear something about pain in the hip and in the back spine area. Young women could very easily develop pain in the pelvic area and the back area because of imbalance of calcium. The way they would know that, the pain would be worse before they begin their monthly cycle. If they notice that the pain is worse around that time, it's probably related to a calcium deficiency. I can test that almost immediately and let you know if you're the person. If you stood up and squat without touching anything and raise up, that could pretty much tell me if you got problems with your bone structure. If I hear click, click, clack, then you have problems with your bone structure. Because I can listen to your bones, and I can hear noise coming from your knee or your pelvic area. And it'll make a sound if you listen. If you have problem with your bone, you bend down, and if you say click, clack, that tells me something wrong with the bone. If I don't hear that, then I would have to look at your spine and see if it's twisted. That could tell me if it's scoliosis. And so that's probably what I could do.
What about leg pain? Like
what pain?
What about leg pain, you know, where the leg goes numb or it's weak or it just hurts?
Okay, but now is it in the back of the leg, the front, the knee, or where?
Kind of all of it. A lot of like maybe the thigh and then sometimes the foot. But it's only the same leg.
Okay, but and that's the only place where the pain is.
Kind of, but
now
it's a different expression of pain, but it starts like in the back.
Okay, now I noticed that you was doing something to your abdominal area. I have trained myself to be like a human x-ray. I've watched everybody that I've come in contact with. And I observe everything they do and listen. And the person don't know I'm watching to see what they. Now, I don't want to make you feel uncomfortable. But I observe everything, so just in case people ask me questions, I can respond. I did notice you in your abdominal area, in this area right through here. And it may be totally out of left field. If there are some problems in that area, then your pain may be related to your bowels. And if your bowels, if you have an impaction, small impaction on your sciatic nerve, it could radiate down to your back and your legs. And there's nothing wrong with your back or legs. It could become from a nerve reaction. I don't know. That's just my speculation. And I don't mean to make you feel uncomfortable. Okay.
Any remedy for belching?
Belching is belching a lot? I mean, when you say belching now, I'm talking repeated belching and belching and belching. Okay, well, that's better. That's a lot better. Because if you belching and it has nothing to do with eating, that's a serious problem. Belching after eating is a digestional problem. That's a digestional problem. That simply means that babies belch a lot when they're nursing bottles, drinking out of a bottle, and get too much air in their stomach, and they belch a lot. Grown people, when they eat, they can get too much air in their gut or their stomach, and they'll belch a lot. And if their digestion is messed up, they will start belching. I would say what you want to do is to get 3 different digestional enzymes. You want to get one called beta HCl, hydrochloric acid. And you buy it at the health food store. And you want to take 500 milligrams of the beta HCl, or hydrochloric acids. You also want to take pancreatic enzymes. The beta hydrochloric acids for your stomach gas juices. The pancreatic enzymes is for your pancreas. Take 500 milligrams of pancreatic enzymes twice a day. And definitely do this one. Tell them to eat 8 papaya chewable supplements right behind each other. You could eat the whole bottle, it wouldn't hurt you. But just eat 8 of the little chewable papayas. You eat 2 or 3, it ain't going to do nothing. You got to at least eat 8 or 10 of them, and that should stop his digestional problem or whoever you're talking about, and that should render that problem. It's a digestional problem. Yes, ma'am.
I would like to know if you have any empirical evidence that moringa does anything to cure or adversely affect cancer of any kind, and also if you have heard of the one that grows in India, is it different from one that grows here? And I wondered if you had anything else to say with respect to that, sir.
Now, what was this? Is this moringa? You mean moringa?
Yes, moringa.
Yeah. The moringa that grow in the tropics and in India, it's basically the same family. Yes, it's basically the same. Moringa is a very fortified plant that is very fortified in minerals and vitamins. It's a powerhouse of mineral and vitamins. It's good for a lot of things. I I would say that yes, if a person has cancer, a weakened condition, I would give them moringa. I would do it. It would strengthen them. There's no one product going to cure cancer. Cancer is systemic, so it's going to take a total protocol. But moringa will help them replenish some of their nourishment.
Difference between Jerusalem artichoke that you had in one of your remedies and regular artichokes?
I don't think there's any difference at all. I really don't. I think they are the same, basically the same artichokes.
Okay, thank you.
Okay, I have two issues, health issue. One is my thyroid. I heard your wife mention about Graves' disease. Anyway, right now I'm taking T3, T4 compounded, and I really want to get off that. I went to Wildwood last 2 years ago, I think, and they said that I have to continue taking it. There's no way. It's like a car. If there's no gas, there's, you know. So anything you can advise?
My wife, she's a classic. I mean,
okay.
She have not been on no thyroid medicine now in over 17 years. Wow. Not 1 ounce.
So.
And she was bad. I mean, the worst we thought we were going to lose her.
Mm-hmm.
So you can get off of it, but you have to know the right diet to follow.
Right.
Most people that work with thyroid don't understand that diet is the main problem with it. Certain foods will speed you up, certain foods will slow you down. Mm-hmm. Certain foods will suppress the thyroid function. They have to really understand nutrition to understand that. And I'm afraid our lifestyle centers do not understand this concept. Mm-hmm. I try to work with many of our lifestyle centers, and their understanding of dealing with disease is just not there. They need to deal with lifestyle problems, obesity, a little high blood pressure, a little high. Those things they are good at. But when it comes down to diseases, they shouldn't even fool with them because they have no concept how to deal with it.
So do you have that in your...
It's in my book.
In the book.
Back to Adam. Hypothyroid, hypo, either one. And if you need a customized program, which I would advise you to do,
yes,
contact us and let us put together a customized program.
Okay, okay, because I really like to have some coaching, because I know I have this book already for a while and I'm reading it. I took some of it and I tried for 1 week that I did not take the thyroid pill, but it was hard because I'm working and I cannot follow through.
Right.
Anyway, so, okay, I'll get to you on that.
These books are treatment protocols, and they are what you would go through if you came to our clinic. And so it's not taking one or two things. Getting rid of disease is a full-time job.
Yeah, I know.
And so you got the best person sitting right beside you. She's
we've been
good.
trying to.
So get her to work with you with that.
The second one is, how about the osteophyte that, because I have a neck problem on my C5 and C6. I have osteophyte and it's really compressing my spinal cord.
Well, like I said, this is where anytime you have problems with your spine or bone structure, the DMSO and the olive oil treatment is what I would use because it takes the inflammation and
How often do you put?
I use it every night.
Overnight?
Every day.
Every night?
Every day until I reduce that inflammation.
Okay. All right. Thank you very much.
All right.
I have a question also on the thyroid. I have a question.
Yes, ma'am.
So you're saying that you can be off all thyroid medicine even if your thyroid has been radioactively destroyed completely?
I sure didn't say that. No, ma'am, I'm not saying that. I'm saying if you have your thyroid has been burnt out by radioactive iodine, the only way you're going to get off all medicine is you're going to have to go into a very late post-menopause. Some women have been able to get off when they go into post-menopause because your body do not require as much of your thyroid function once you get into post-menopause. But typically, you would have to be on some medication to help regulate your body until that happened. I do know some women that have been able to stop taking it and live a normal life, but they couldn't do it until they really got into postmenopause. But right now, if you're still not there, I would recommend that you take some because you don't have any thyroid function.
Okay, Brother Wilson, I think we are winding down. Now, I have a question. Frank, you had one? Go ahead. Go ahead first. Go ahead. Wife is good, man. Now, this is not necessarily totally just a health question. We're looking at now, one of the challenges that we find ourselves in is that, again, we receive a lot of information. We get training. What are some practical things we as a church community can do? Because, like I said, it's one thing for us to receive this information, help ourselves. But I don't think that's the end of it. God wants us to use this information. How can you, what advice can you give to those who are still remaining here on using it as a medical missionary tool, and also maybe how some folks can also get training at Centurion?
Well, the first thing I would recommend that you need a more intense training program. This is more like a training seminar. You need a very intense training program. We need to transport some workers here that will come here, and my trained nurses, along with Mamon, that can come here and actually run to people through some protocols, some treatments and training. And then once we get a person trained, we need to look at trying to open up a facility to be able to continue this ongoing training and development. So I would say the first thing, get a more intense training program set up. The longest I can be away is 2 weeks. But I have workers can be away much longer than that. I have nurses that have male and female nurses that travel anywhere around the world. They can come here and live here and move in with a patient and do everything for that patient. And they would prepare food, they would do treatments, they would do everything. They would follow the protocol that me and my wife designed. I would put together the products that I designed, the herbal chemos and the special products. They would bring those and set it up. That's what I would recommend right now. Let's look at possibly get back together with a more intense training. Then let's look at having some workers come here that will stay here and help the church to be able to develop an ongoing health emphasis and treatment program by visiting the people in their home. It wouldn't have to be done here. When those workers come, they could go to the patient's home and treat them out of their homes. Once we do that, then we look at a facility.
In relation to that, because even part of our 5-year plan, of course, we had written down about, continuous medical missionary work, and we had that quotation, every church should be a training center for Christian workers. I know you guys are busy, but just throwing this out there, I know there are several people who have come to the valley. The valley, like we said, spans more than just here. It's a very large territory. There is a big need for a lifestyle center of sorts in this community. There's no reason why we have 35 Seventh-day Adventist Church, over 7,000 members listed, and we have absolutely zero things for people who are suffering as much as people are suffering here. Just to put it in mind, because like I said, several people have tried. We have different issues going on relating to that. But might you be able to help us? If there are a few people who are willing and willing to do the groundwork and whatever, cooperate, might you guys be willing at some point, or even if you got to send people, to help us set up some type of an institution, a lifestyle center within the valley?
Yeah, I think that if we could have someone from here to come and go through our training, that would be the fastest way to do it. Then they would be equipped to come back here to continue an ongoing program. We don't need a big facility to do this work. All we need is a home with a couple of bedrooms freed up for patients. And most of the time when people start looking at trying to open up a lifestyle center, they're looking at a multi-million-dollar operation. I don't look at things like that. I look at it, every home should be a health center. And I believe that if we start small by converting small homes into it, then we don't waste time doing that. At my place where I'm at now, at my main facility, I have 5 bedrooms in it, in one building. And in another building, I have 4 or 5 other bedrooms. And then I have, I don't know, maybe 6 or 7 cabins. But when I started off, all I had was just a house with 2 bedrooms. That's all I did. And it was in my house with my family. But, you know, as I continued to work, Lord bless, it began to grow and grow and grow. Since the time Melbourne had been there, they wouldn't even recognize our place. Now it's totally changed. So I'm just saying, start off real small and project that it will grow. Secure a house and begin there and let it develop. And take in 1 or 2 patients at a time and let it develop from there. If you can get someone that will come and go through the training, that will speed it up. If not, we could come here and do a training.
So, Saints, I hope you guys have heard that.
The training is 30 days. We have a 30 days on-campus training. We start in April. We had to do 3 schools a year. We can take in somewhere between 35, 40 students at a time.
And the fee includes everything, right? Books and food and
Everything is
living.
covered with the $3,000 donation. All our students upon graduation are offered employment. We are the only institution that offer employment on our graduate students. We have our own employment system. I did that because when I was in the work and when I wanted to do the work, there was no employment for me. You know, our lifestyle centers wouldn't take me in because I'm not a doctor. So God told me to do my own accreditation and do my own employment system. And so that's what I did. And so because I get so many people need help every day, 30, 40 people call me every day need help. I can't meet those needs. What we set up is a home health service where people call me, I send the patient to you, they'll live in the home with you, they do everything, we write up the program, and you give them $125 a day to meet your needs. 100% of that goes to that worker. We don't take 1 penny of it because we want them to be able to maintain in this work. And I have people, I send people to everywhere from the Philippines to South America to Europe to London. I send people everywhere to do this work. So it's not just in America.
Amen. That's powerful. More questions. We don't have to like make up questions now. We can kind of, taper off. Go ahead, brother.
The remedy for the formula for coughing and congestion, is that safe to give to a baby, a toddler?
Well, an infant, no. I mean, you have to make a special formula for an infant. An infant is different from a baby, infant that has no teeth, you don't want to get them honey.
No, they have, in this case, 17 months.
Yeah, I mean, as long as they got teeth, they can take honey. I would probably decrease the strength. I probably wouldn't put any cayenne in it, and they can take it. It's not a problem at all. It's just that newborn babies, I wouldn't give that to them. I would make it a certain way for newborn babies. What I do is I distill raisins. I make raisin syrup, and I make it out of that instead of honey. And I can give it to babies. Yes.
As a Seventh-day Adventist, we realize that even today, even as I speak, there is still no bridge between the medical field and the churches in terms of ministry. What could be done in order to make this happen? Because we're actually living the end time where evangelism and the medical work should be
Amen.
Working hand in hand.
Yes, and I'll give you a good example of what you're talking about. I work a large in a lot since I worked with Northeastern Conference of Seventh-day Adventism and Greater New York Conference. Those two conferences are doing more than any conference I've ever seen. Northeastern Conference, they're from the president all the way, are promoting medical missionary work. The doctors are all supporting medical missionary work. So it's totally different. It may be that I would have to bring in some of the leaders in the Northeastern Conference that come here that implemented the medical missionary program up in the northern New York area to come here to put on some programs. They are really good, and they know how to get the doctors and all of those involved. They put on seminars just for doctors first to introduce them to medical missionary work, because our doctors and our nurses is the key. That's why we cannot attack the medical system. We need the medical-minded people because they have what we don't have. They can do things we cannot have. We need them, they need us. And so what I try to do is to show doctors their rightful calling. Originally, from the very beginning, doctors were to have the same stations as ministers and pastors. They were to be supported by the tithes, like the pastor. They was not to go into private practice. Once a doctor sees how sacred his calling is, that he has the same calling as a pastor, and he'll see a greater need not to be secular employed only, but to use his medical skills to help the gospel. Then I think we can bridge that gap. So I would say, to answer your question, let's bring in people that already done it. Let's ask Pastor Daly, that's over the health and temperance over the Northeastern Conference, to come here, and another people named Monet and them to come here and put on an outreach program. Monet and them is a beautiful family that is working all the churches up in Northeastern and working with the medical system. I would suggest something like that. And I know they would be happy to come here to show y'all how to get something started in the medical community and also the laity in the church.
What you say right now, I think is the best advice you give us, that we need to have a combination, with traditional medicines, with the natural medicines. We have all the information through the Sister White, and even in the Minister of Healing, she advised people to use a different thing that we are not allowed to, like use eggs, for the anemic people, even to recommend meat. Right. So, and then we don't need to be so, just on one side. We need to open our mind and try to use the resources that our church has.
That is true. Now, Ellen White, I'm going to give you an incident. There was an incident where she lectured on not using drugs. And this man heard the lecture. And when he heard it, his daughter came down with malaria. Some of y'all may be familiar with it. And so he said, I'm not going to use drugs because the spirit of prophecy said we shouldn't use drugs. And he wouldn't use it. His daughter died. Now he's mad at Ellen White. So when he see her, he challenged her and asked her what he should have done. She said, you should have used the medicine. All right? See, you don't want to be like the Mesorahs. Do nothing. God said it'd be better to do something wrong than to do nothing. Because if you're doing something wrong, he can say, hold up a minute. I see your zeal, but you're going the wrong way. But if you ain't doing nothing, God can't use you. So it'd been better to use the drugs. If you do not know what to do, use the drugs. But once you know what to do, you don't need the drugs.
One last question. I'm looking forward to going home to the Philippines and apply all these natural remedies. But there is a situation there where the government is going after the drug addicts. So is there a natural remedy that we could use for detox and cleansing, like a drug addict rehabilitation program, like a drug rehab program? If you have like something that you have set up for this type of problems.
Well, I do know we have some for alcohol. And I know for people that are addicted to alcohol, there's an herb called club moss. And if they drink the club moss and drink a shot of alcohol, a liquor right behind it, they will never be able to drink alcohol again. They will develop an allergic reaction to alcohol the rest of their life. So I do know that one works. Now for drugs, there is a herb called morning glory and passion flower and valerian. We give that to people on cocaine and hard drugs. It will not make them allergic to it, but it will take away that desire for that stimulant. Back in morning glories, hippies used to use morning glories to calm themselves down when they come off of heroin and hard LSD. And they would take morning glory tea for that reason. So morning glory and passion flower and valerian is the only thing I know will calm them down. So you might want to look at that. It's in my book also. And also the club moss is in my book. You know, I've enjoyed it. It's been wonderful. I thank God for your patience, for having us here. I hate it had to be so short. I like what I see, Pastor, and I'm just hoping that we can work together to get this church involved. Y'all are blessed to find a pastor like this. Don't let the conference move him. Y'all protest to keep him. Because, boy, you may not get another good one, all right? And you've got a good one. So that really see the vision. And I thank God for that. When I came in here, I didn't see all the drums and I didn't see all that craziness. And I said, praise God, I don't see it. So anyway, my prayers are with you. Any way we can help you, we would love to do it. And we're going to pray that that facility will come so you can have a place here to use and to work with. And we're going to pray for workers. And so if you don't have anybody come, maybe you can pool your resources and send somebody. Send some of these people that want to be trained, let them come and get the training, and then let us bring some people in here to try to help the church out.
Amen. How about it, folks?